My name's Lisa Huguenin. I'm one of the sports physicians at MP Sports Physicians. We're here today to have a little bit of a chat to you about concussion management. Concussion management has changed quite a lot of recent times, and we are finding out more as time goes on. Essentially, we want trainers to be very aware that concussion is not always easy to diagnose. If you do have a player who has been concussed, we would highly recommend withdrawing them from the game and not letting them return to football until they've had a medical clearance. If you do have somebody who you think might be concussed, we would expect you to observe them for a period of time before making a final decision. But remember, it's always better to err on the side of caution, withhold somebody from the game and then return them when you know things are safe.
Hi guys, I'm Dr. Sachin. I'm one of the other doctors in MP Sports Physicians. After the introduction by Lisa, I thought of sharing a few thoughts about how we manage concussion on the day and subsequently. So concussion is basically a brain injury. You can have an athlete can have a concussion whether he comes in contact with the opponent or hits his head to the ground, or many a times there actually need not be a contact to get a concussion. So it's really important for everyone, including doctors, paramedical staff and trainers, to pick it up because it can have grievous consequences. There are a few signs which really can point out towards concussion, but it happens so subtly sometimes that it's very difficult to pick it up. The athlete can complain of some symptoms like headache, nausea, irritability or vomiting, or sometimes fits, but again you need to be vigilant to pick them up. If any diagnosis of concussion is made on the field, the doctor or the trainers point out and then the athlete is assessed on the sideline. There is a questionnaire in form of SCAT-3, which very shortly is going to be renewed into SCAT-5, which involves testing with questionnaires and other symptoms to give an indication for concussion. Whether the athlete clears the form testing or not, it does not make a conclusive diagnosis, but gives an impression whether he had or he didn't have the concussion. If he lost his consciousness, or he had memory loss, or there were epilepsy, or fits, or there were any different postures, it is almost definite that he had concussion. If any diagnosis of concussion is made on the day, the athlete as a rule should be pulled out and doesn't go back to the play on the same day. He needs to be monitored because it is an evolving injury. An athlete who was very subtly concussed can develop serious symptoms later on, whether within 4 hours or up to 48 hours. So there are a few things which need to be done on the same day of concussion. One and the foremost, try that he doesn't drive back home, for example. There should be somebody at home to assess him when he sleeps, so that if there are any signs of increasing head pressure or injury in terms of increasing headache, or he loses speech, or he goes into coma or loses consciousness, we need to really rush him to emergency department and get him scanned and checked out. Subsequently, the doctors need to evaluate him for the symptoms and ongoing process. The idea should be that he should be made to return to training first before making a call for return to play. Return to training has to be graduated with minimal exertion to start off and making sure no symptoms come up. If there are no symptoms, then his training can be progressed further with more severity, and the contacts and the functional drills to be kept at the last. After he has cleared all the training drills, he can be deemed positive and fit to play. There are a few things which can come up as symptoms which can have prolonged symptoms, which we will talk in subsequent videos. Thank you.
How you going? My name's Liam Garrity. I'm one of the new doctors at MP Sports Physicians. So we've already had a bit of a chat about concussion and its initial management. What I want to have a chat about is concussion in children. As many good paediatrician will tell you, that children are not little adults, and how we manage it is certainly a lot more conservative compared to adults, so especially in regards to the developing brain. So usually with children, certainly primary school and under, if they were to sustain a concussion, you would want them to be at least have 2 days of complete brain rest, which means no TVs, no phones, no computers. I know that's going to be tough on the kids. But in particular, the goal is return to learn. So important thing is what you need to do is liaise with your local doctor or sports physician, as well as your teachers, in regards to the child returning to appropriate levels of schooling. That might include things like extra breaks, more time to complete tasks, less homework. Again, I'm sure the kids will love that. So, and half days or other strategies like that. So when the child's able to return or is not showing any symptoms at schooling, they'll then be allowed to return to a graduated training program. So important to note that the AIS and the Australian Medical Association do recommend that in younger children that they should have or consider a mandatory 2 weeks off from their initial concussive incident before they consider return to play.